Hey there, my name is Scott Camden, and I serve as the Advancement Director here at Sandals Church. And a day ago, we got a phone call from one of our members. His name is Dr. Doan, and he's one of the amazing staff members at a local hospital, Riverside Community Hospital to be specific. He shared with us some things that really concerned us and have moved us to action. See, he talked to us about the current state of crisis, what the doctors and nurses are faced with day in and day out, 24 hours a day. And we knew that there was an opportunity to share this information with you and then invite you to be a part of the solution. So I want to invite you to join me on this FaceTime call with Dr. Doan. Hey, Dr. Doan, it's great to see you. How are you?
Hi, Scott. It's good to see you.
Thank you so much for taking some time to connect with me today. I know you're busy, but I was hoping that on the heels of our call yesterday, that you'd be able to share with us just the current experience of the doctors and the nurses at Riverside Community Hospital. Just share a little bit about what's going on right now.
It's my pleasure to do that. We need to let our community knows what's going on with the problem that we have in Riverside right now. What you have heard happened in New York in the spring is happening to us in Riverside here. As of this morning, just moments ago, my hospital, Riverside Community Hospital, just declared an internal disaster. What that means is that we are no longer accepting ambulances unless the patient has a stroke, a heart attack, or a significant trauma. All other traffics have stopped. Because of the COVID situation. It is very severe, and at our hospital alone right here, the COVID patients have increased 6% every single day, and we are running out of our ICU here at Riverside Community Hospital. The number one thing right now is that we have too many patients. There are too many people getting sick. The nurses can't take it anymore, so they simply quit. Or they will call in sick because they are actually sick themselves, or that their family member is sick, or they have to stay home to care for their children. Remember that many of our schools don't have classes, in-person classes now, so the kids have to stay home, and there's no one else to care for them at home, so the nurses have to stay home. So that's one problem. The problem of lack of nurses, and then on top of that, is the nurses that are working are just emotionally exhausted. Their patients are too sick. They can't even leave their site for 5-10 minutes. Something is going to happen rather quickly. And it's just that bad right now. And then the nurses don't feel appreciated, okay? And when they're at work, not only they're emotionally exhausted, they're physically exhausted. They don't have enough time to eat. They have to eat on the run. There's not a good place for them to eat because inside now, hospital can't have too many nurses congregate to eat. And they can't go to the cafeteria because it takes time to walk 5 minutes, 10 minutes to order food, and then not enough time to eat. They have to care for their patients right here and right now.
Yeah, so what I'm hearing is that there really are a couple different areas where there's significant challenge. It's having the number of nurses available to care for the patients. That's one issue, is just not having enough nurses. Then there's the issue of just the mental, emotional, and spiritual well-being of the nurses that have been trying to administer care. They're exhausted in one or in all of those areas. And then we kind of continue on with the physical challenges in that they need fuel in their body to be able to do the work that they've been trained and equipped to do. So if they're not able to get a healthy meal in a reasonable amount of time, many of these nurses are choosing to not eat at all because they're prioritizing patient care over their own well-being.
That's correct. That's a good assessment, yes.
Okay. If there happens to be a retired doctor or nurse, or maybe somebody who's not on a full-time rotation that has that experience and training that's watching this video right now, is there anything that you could share with that audience that might be relevant to them?
Absolutely. We need you all. So we can use all the help that we can get right now. So if you're a retired doctor or a a nurse that is available right now, we can use in the hospital. You are so desperately needed. Not only nurses, but also respiratory therapists. We'll have a channel, to make sure that you are credentialed well and that you are well protected when you work at the hospital.
Great. Well, Dr. Doan, thank you so much for taking a little time to talk with me today and to share with our audience really the current experience that is happening at Riverside Community Hospital. We're so grateful for you and all of the other doctors and the nurses that are serving there. We're praying for you guys regularly, and I'm looking forward to speaking with you again, and I'm looking forward to also being a part of the solution to address these different areas that we've talked about today. God bless you. I hope you have a great afternoon.
Yeah, thank you, Scott, and I am so thankful for my church. Anytime that we have a concern, a problem, I can speak to you guys, and within a few hours, our church rise up and respond in a way that is very meaningful and truly appreciate it. So thank you, all of you, and our church leadership, and all of you who are our church members that have been regularly taking part in our ministry. Thank you for being part of this and bringing a solution to our crisis. Thank you.
Great. Thank you, Dr. Doan. So in light of what we've just heard, we want to invite you to join us in bringing light to our local healthcare heroes. Here's how we're going to do that. If you'd visit sandalschurch.com/Project Light, you'll learn about how you can give a gift to provide a meal to a hungry nurse or a hungry doctor. You'll also learn about our various volunteer opportunities. See, these volunteers will support the amazing medical teams at Riverside Community Hospitals. You can learn about those opportunities, and you can sign up again by visiting sandalschurch.com/Project Light. However you choose to join us in this, we're so grateful for your partnership as together we strive to bring light to our healthcare heroes.